So here we are having my annual health check, which is something that every bloke should do, but I've chosen to do it in September now. Normally, in the past I've done it every August, but now I'm changing it to September to celebrate Blue September, and as a reminder to me, and I think this is a great thing for all guys in September to have a health check.
Mark, how do you feel about blood tests? Are you okay with having blood taken? How do you feel about it?
I hate having, to be honest, having the blood taken is the worst part of it. And Kate, what are we taking the blood for? What's the blood going to be taken for today?
Yep, we're looking at a whole range of different levels, Mark, today to test in your blood. So cholesterol, full blood examination, fasting blood sugar, PSA as well, liver, kidney, thyroid function test. So it's a very thorough blood test today. It's great that you've been coming in for so many years. We've got a great history now of all your records, of all your results that we can check back on today. So I think that's really important.
Excellent job. I might have to give you a touchdown, Kate.
Oh, that's great.
That was really very good.
Good.
That was really very good. And
So,
I'm going to give you a little 1 point right there.
Oh, a 1 pointer? All right. We'll take that. I'll just
See how much I've shrunk this year.
Hopefully not too much. Just chin down a little bit there for me as well. Good. And just slowly stepping forward. 182.3, I've got you on there.
Okay.
Yep.
Oh my Godfather.
So, all right,
How
so
can that be?
98.5.
Oh my God.
On 105.
Ooh.
Okay, so take a seat and I'll explain that one.
It's not good either.
28.5 by 3.34. Yep, so 29.49, which is at the upper end of the overweight category, almost into the obese category. So, yep.
The reality of doing this year after year is that I can't hide from the facts.
I mean, it's important to know that obviously you would expect weight gain to occur with what you've been through with the cancer and the surgery and being unable to exercise. So don't be too hard on yourself with all of that. But the next test we'll do is your lung function. So this is called a spirometry machine.
Which?
Spirometry.
A spirometry.
Spirometry machine.
What a great word. A spirometry.
Yes. Now, you quit smoking a number of years ago, I
I've
believe.
quit smoking, yes.
Congratulations.
Thank you.
So
Yeah.
that was how many years ago?
Oh,
Was
God.
it over
Years
5
ago,
years?
yeah, so well over 5
Yep,
years. Yeah,
great.
Okay.
So I'll give that to you. So when you're ready, maximal in and then blast it out. Push, 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 push all the way. Empty your lungs. Good. Okay, have a rest. Well done. Yep, good. You're all right?
Yep.
Yep. At 96, that's a good normal capacity.
So my lungs are normal capacity?
Normal capacity, and your lung power is excellent. It's 99%. So let's have a look at your flexibility. Last time you were only reaching, well, a long way from your toes. So we'll see how we go.
I'll be as bad or worse now.
So one hand on top of the other.
One hand on top of the other.
Nice deep breath in, and as you breathe out, slowly stretching forward towards that marker. Don't overdo it. If we're not going to get there, don't jerk too much there, Mark. Just yeah, have a rest there. Mark, at the moment your flexibility is considered poor, which increases your risks for back pain and injury significantly. So we'll also have a look at your abdominal strength depending on how your back is. Lower back, are you okay with doing sit-ups? Sure. Yeah? Do a sit-up so that your wrists come up to your knees.
Oh.
Yeah. No, we're not going to get there. No. So the next thing we'll do is a resting ECG to have a look at your heart function and make sure everything's functioning as it should be within your heart system. So I'll just get you to pop your t-shirt off and have a lie up on the bed. That one. Okay, Mark, so tell me about your alcohol levels. How much are you drinking through a typical week?
During the week, most certainly I never have more than 2 a day.
Yep. Weekends, though, would creep
Weekends
over.
may creep up, depending on if there's a football game on.
Yes.
Which generally there is.
Yes. Okay, alright. So I'll just measure your blood pressure now.
Okay.
So that's actually what we call a high normal reading. 132 on 82.
Okay, time for a urine sample. So I'm going to use some of Ben Cousins.
Aha.
Hello,
Hey, Dr. Bell.
We're off and away.
How are you going there? All right?
Not bad.
All right. It's going coming up to the 10-minute mark. Still going okay?
Yep.
Yep. Well done. You're doing well. I've put the machine now in the recovery mode. The machine is slow down, doesn't come to a complete halt. It does come back to a horizontal position, which makes life a bit more comfortable. Yep. It's standard practice to go on observing you for 3 minutes into the post-exercise period. Once you've got your breath back, I'll actually stop the bell. Okay. Now, Mark, with respect to your skin, are there any concerns of either you or your wife noted any lumps, anything that you think has changed?
Well, I wouldn't mind if you just check my scalp, because there's just a few little bumps around like that. That I just wonder what, they've been there for a while. Okay. They're not new.
Okay. There's a small lesion here, the dark lesion. That's been there for some time.
Yes.
Yeah, that's okay. That's fine. And I'll get you just, if you wouldn't mind, to just take, if you can slip your underwear down just a moment there for me. I'll give you a bit of there, that's fine. Okay. And I'm just going to examine your prostate.
Yep.
Now, you've had your prostate examined before, so you're reasonably familiar with it.
I am.
Similar to last time, my advice is always that it's more comfortable for you if I can take the examination slowly. So please just be a little bit patient with me. All right. It takes me a minute or so to get into the right position to actually feel the prostate gland, and I'll talk to you just as we do that.
Okay.
Okay. Just with examining you today, as I say, it's more comfortable if I take it slowly. Mm-hmm. Bear with me. I'm now just going to feel down for the gland itself. Mm-hmm. Thank you for that. That's fine. Okay, you're right to now pop up and pop your things on.
Okay.
Mark, today I think things are going fairly well, and I think you've done very well to get through the patch that you've had. However, as you know, you have been overweight and your weight has been creeping up a bit. Yep. We need you now to get into that lifestyle change, because the work you do for that will give you better health in the longer term. It's up to you, but at the moment, today, we want to focus on your future health, how you're going to be over the next 20, 25 years. And the work you do now... The weight is the problem. The weight is the problem, and it's a little bit like your superannuation. The work you put into that now will pay you in terms of lifestyle dividend in the later years of your life. The question you've got to ask is whether you're prepared to sort of make that effort.
Yeah, but the prostate was okay?
The prostate felt quite normal. I haven't yet got your PSA results back, but that will come through. But today I'm very comfortable that the prostate examination is normal.
Okay, but it's so funnily enough, the reason I came in here, my biggest concerns, that is my being touched by cancer this year and my fear of prostate cancer. What I've discovered is that my biggest problem at this particular point is actually my weight. And my weight is something that I have not taken control of. Even as I've been concerned about cancer, I have let my weight creep up, and that's to the point, in fact, where I was told that I'm verging on obese, which is pretty scary. So I do need. The point of having this health check for me is, okay, I've got a clear on my prostate, but I've got another health issue that I really do need to take care of, and that is I do need to get back into good eating, sensible eating, and a better lifestyle choice, and reduce this girth. I need to reduce this girth from 105 to less than 100, right, Dr. Bill?
Absolutely.
So I've got a job to do.